Good morning, all. It's great to have you here. I want to begin today with a story, not about a client, but about a worker. A few months ago, a social worker, I'll call Smita, attended her team meeting carrying a backpack. Nothing unusual, except she didn't take it off. Not during the meeting, not during her supervision later that day, not even during lunch break. Finally, someone joked, "You planning a hike after work, Smita?" She smiled and said, "Honestly, it just feels easier to leave it on." What no one realized was that the bag was full, really full. Inside were heavy case files, half finished incident reports, a policy binder, stack of forms she kept meaning to return to her desk. But the truth was that the physical weight was nothing compared to what she carried invisibly. The emotional weight of client in crisis, the moral weight of decisions she didn't always agree with, the cognitive weight of shifting priorities, the pressure of too many responsibilities and not enough time, and the constant quiet question, "Am I doing enough?" Smita told me, "It's like the bag became a part of me. I didn't notice how heavy it was until someone pointed it out." As I think many of us here today know that feeling. We carry our own backpacks, workload that keeps getting heavier, limited autonomy where we're told to follow processes, unclear roles where we never quite know what will land on our desk next, value conflicts when decisions we must enforce don't align with what brought us into this profession. Over the time, all that weight becomes so familiar that we forget it's not supposed to feel this heavy. Today's session is about recognizing that weight, not with blame, not with guilt, not with just try harder, but with compassion and curiosity. It's about asking, how did we get here? Why does it feel unsustainable? And how can we rethink practice in a way that honors the workers, not just the work? This webinar is our moment to pause, open the backpack, look at what's inside, and begin imagining what a more sustainable, more human approach to social work could look like. Before we move further, let me invite Miss Lindsay Francis to read the MASWO land acknowledgement. Over to you, Lindsay.
Thank you, Sonia. The land acknowledgement. As we gather virtually today from across Ontario, we begin by acknowledging that the land we are on is the traditional territory of many nations. These include the Anishinaabe, the Haudenosaunee, the Wendat, the Mississaugas of the Credit, and other diverse First Nations, Inuit, and Métis people who have lived on and cared for this land since time immemorial. We honor the enduring presence, wisdom, and contributions of Indigenous peoples, and we recognize that Ontario is covered by many treaties, including Treaty 13 and the Williams Treaties. As settlers, including those of us who are part of the Malayali diaspora, we reflect on our responsibilities to learn from and stand in solidarity with Indigenous communities in their ongoing effort for truth, justice, and reconciliation. Let this acknowledgement be more than words. Let it inspire action, humility, and a deep respect for the Indigenous peoples whose land we now live and work on. Miigwech, Nandi, thank you.
Thank you, Lindsay. I would now like to introduce the president of MASWO, Mr. Verghese Jacob. Mr. Jacob is a Master's of Social Work graduate from Indore School of Social Work with over 20 years of experience in the not-for-profit sector. He has worked with organizations such as World Vision, UNICEF, USAID, and Bill and Melinda Gates Foundation, focusing on social development, advocacy, and community initiatives. Currently, he is involved with Child Protection Services to promote the welfare of vulnerable groups, and he serves as a board member of the School of Social Sciences in India, and as president of MASWO, supporting the growth of social work practice in Canada. May I now call upon Mr. Verghese to address us with his welcome greetings from MASWO.
Thank you so much, Sonia. Thank you, Lindsay. Good morning to all. On behalf of MASWO, it's a great pleasure to warmly welcome you all for today's webinar. I'm especially excited to see guests from Alberta, fellow social workers from UK, Australia, and India as well in this webinar. We are especially grateful to be partnering with OASW in bringing together such a thoughtful and committed community of practitioners, scholars, and advocates. Social, as social, we all know, as social work at its core is a profession grounded in care, compassion, and resilience. And yet, as many of us know, the increasing demands and complexities of our work can often lead to exhaustion. And today's conversation, I believe, invites us not only to reflect on these challenges, but also to reimagine how we can sustain ourselves, our practice, and the communities we serve. We hope that this webinar provides a meaningful space for dialogue, learning, and renewal. And each of you feeling inspired and supported in your ongoing work. I would like to especially mention Dorian and Shirley for conceiving this workshop, which could not have happened at a time like this, like a better time like this. So thank you once again for joining us, and we look forward to an engaging and enriching session. Thank you.
Thank you, Verghese. Our guest speaker today is Mr. Dorian Whelan. He's an MSW, RSW, and currently a manager of community development and outreach for the Ontario Association of Social Workers. Dorian has spent 16 years as a social worker in child protection and 6 years as a forensic interviewer at the Waterloo Region Child and Youth Advocacy Centre. He also served as a provincial sector representative on the Ontario Public Service Employees Union, a CES divisional representative, and a local union leader. Dorian has extensive experience with workplace human rights complaints, organizing and promoting safety and wellness. He has also volunteered as an auxiliary police constable. Currently, he practices as a social worker supporting survivors of sexual abuse of all ages. In 2024, Dorian joined OASW as a community engagement analyst, and in 2025, he shifted to his current role, focusing on community development, outreach, and communities of practice. May I now call upon Dorian to address us with his presentation. Thank you.
Thank you. Let me just share my screen here. Oh, sorry, I did check this morning, so entire screen, there it is. I apologize, we usually don't use Google Meets, and it's just different enough that it throws me a little bit first thing in the morning. So thank you so much for that introduction. Before I begin, certainly on behalf of the OASW and our CEO, Ajiri Agena, who can't be here today because of a board meeting, we're very grateful for this opportunity. And so we met, I think it was just a few weeks ago now, and MASWO said, hey, are you interested potentially in doing a webinar? And I thought, yeah, I don't have any time for that, but neither do they, and we still want to do it, and we kind of pulled it together. So I'm very grateful for how much weight MASWO pulled in this. As you all know, we hopefully know, we just finished Social Work Week and Social Work Month. So we're really excited that this webinar has been added as a celebration, and to be doing some outreach with other social workers doing some awesome community work. But yeah, we wouldn't be here without Shirley and Varghese and Ashish, Urbaz, the entire panel. They've pulled all this together while working, right, while doing all the things that we're going to talk about today, just so that we could land this. So it's very much a privilege for me to be able to speak about this and to be here, chatting with everybody today. So I think it's really important that I name right away that a lot of the concepts I'll be chatting about are kind of packaged in a Western Eurocentric framework. And that's just true with a lot of social work discourse. What I like about our profession is at least we can name that. And I want to name, though, that many of these ideas certainly exist within other cultures and ways of knowing and being. And while I have, to speak from my own experience and to be authentic, I do want to name how I believe kind of the future well-being of this profession is really only possible from learning from and with one another and all the diversity that we bring into spaces. So I'm just truly grateful for all the experience here today, all the culture and wisdom and care that I know is gathered with us in this space. I mentioned this morning before we started, but whatever I say today is going to be really incomplete, both because I have lots of limitations about my knowing and also because of time. This is a really big topic that we could all probably talk about for days, but I want to hopefully offer something a bit meaningful And yeah, just talk about this profession that I love, and to have a panel to help wrestle with some of these concepts more concretely, and flush out, anything that I'll probably be missing. So kind of whatever our unique intersections or differences here in the space, what's really cool is there's a common bond right now between all of us. We are all social workers. So yeah, we're a part of a really big, messy, hard, but unique and really meaningful profession. So as we talk about ways to think about impacts on ourselves of the work that we do, I want to name that some of these conversations could feel heavy, right? Some folks are going to be coming in here today really tired, I suspect, exhausted, bringing in all sorts of things from their work or their personal lives or their health. So please just engage as is helpful for you. The nice thing this morning, hopefully having coffee or tea together, is that we can recognize none of us are alone in the weight of the work that we do. We're all social workers. And so, yeah, just know that you're not alone, and whatever you're bringing in, other folks carry it as well. And I hope by the end of this brief kind of conversation, my main point is that we have to carry it collectively, right? It's just far too heavy for any one of us to carry the nature of the work that we're doing day to day, especially in this season. So I super appreciate the beautiful land acknowledgement. Anytime OASW gathers, we do a land acknowledgement and an African ancestral acknowledgement. I hope, to have weaved some reflection and consideration about these dynamics throughout the conversation, but I will just make sure that I speak to our African ancestral acknowledgement as well on behalf of our Black brothers and sisters. At OASW, we recognize the historical and contemporary contributions of Black communities, particularly those who are enslaved and forcibly brought to this land, as well as their descendants. We acknowledge the impact of colonization, slavery, and displacement on Indigenous and Black communities, and commit to ongoing learning, respect about their rights, cultures, and contributions. And again, having worked in child welfare, these are obviously things that I wrestle with, that social workers have to wrestle with, about how we fit into, how we use our power and how our history has both supported communities, but also caused harm. And again, I hope to be able to kind of talk about that just throughout the presentation and not make it its own standalone, but something that we weave into all of the work that we do. So, social work realities in 2026. There are lots of ways that researchers are trying to get at the bigger question of the impact of the work that social workers do on the folks who do it, like us. And there are a number of terms that folks use to capture particular impacts, like burnout or secondary traumatic stress or traumatic stress. But no matter how you try and get at the question, and our own membership data of our almost 10,000 or just over 10,000 members now supports this, social workers are really struggling. If anyone in this space disagrees, we can have that conversation, but I suspect most people acknowledge that there's a lot of weight in the work that we're all doing right now. And so I won't speak to each of the concepts here on the list, but I suspect some of them ring true to most social workers at some point in their career. One thing I will notice, a couple of them, like physical impacts, is a super interesting one. We're social workers, and increasingly we talk about, the connection between our mind well-being and our body's well-being. And in my time in the union many years ago, there was a study done of child welfare workers' physical health and considering, kind of common physical ailments. And one of the things that were identified was actually really high rates of urinary tract infections relative to the general population. Which I also think nursing has done studies with similar results, and there's probably lots of factors behind that, but it's not shocking to me, but it really is a sign of sometimes folks are caring so hard that they're ignoring their body's, most basic biological needs. And if you do that for too long and in a sustained way, obviously it has a cost, and a collective cost on the profession as well as an individual one. I'll also name that, working inside colonial or racist systems is something that it requires some comment from me. I'm someone in a white body, but I have observed over and over again that non-white bodies are just not treated the same way in far too many social work spaces. And the intersections of who folks are and how that fits within their social work, how they're impacted in the workspace, that's real. And the impacts of not being seen and heard are also real and will take their toll. And I really, again, want to acknowledge that, recognizing there are folks with lots of diversity in our space, and that is a factor in terms of the weight that you carry when you are in the workplace. So there is a bit of a traditional narrative. Most of us have probably heard it or kind of hold some of it ourselves. And it's not wrong. It's just fairly incomplete and individualist. So we hear that, witnessing trauma or hearing trauma and the intense trauma of the folks that we work with leads to secondary impact and stress on us and trauma for us as social workers. And we hear that social workers are leaving the profession in many sectors due to the stressors inherent in the work. That's true in child protection, community addictions, corrections, schools. I think every social work sector has its own stressors. And there's a sense, though, that through kind of self-care or wellness or mental health supports, that we can mitigate the psychological impacts of the work. With that kind of narrative, burned out means, that the needs or demands of the folks that you're working with has really worn you down. And, you need some support with that. But research shows that social workers do not leave the work because they stop caring about the people that they're working with, or that they can't handle hearing or witnessing the struggles of the folks that they're working with. Social workers say that they leave, and we've pulled our membership because they care very deeply and are unable to practice according to their personal or professional values. And that's different than the narrative of, it's the folks that we're working with that are, causing the harm or the impact. So we have lots of ways of naming kind of the psychosocial spiritual toll of being a social worker. But many of the frameworks that exist, a lot of the research that has been done, I think, in the last 20 years is, again, puts the problem inside us as individual social workers for the most part. And the distress that we feel, is not a failure of wellness or lack of resilience, but it's a signal of the weight of the ethical tensions that we're each carrying every day. And so I won't get into the more individualizing lenses here on the right, but these frames, I think most of us are familiar with them, clearly locate the problem with us as social workers or in the dyad with the folks that we're working with. Whereas the system lens terms try and place the harm on the more structural conditions of the work. We'll unpack moral distress and moral injury a bit. That I think will be the focus for today. But I think Shirley actually mentioned this. I do want to name sanctuary trauma. I think it's really relevant to us as social workers. And it describes the harm that, someone experiences when a place or system that is supposed to be safe or protective or healing instead ends up causing further harm or betrayal. You expect safety, but you get more harm. And so obviously this reinforces original trauma. And folks that we work with, I think we know this, experience this within systems all the time. And social workers do as well from within the systems that they work. And we can't lose that thread. So, this is a really pertinent example. It comes up a lot, but, someone experiences racism at work. They're part of a dynamic that is clearly unhealthy, and they recognize that this is because of who I am and how I present in this workplace. So you report it, right? Or you're critical of the systems or structures in work. I know of lots of examples where that somehow turns into a conversation about, the racialized workers' performance, or ends up a conversation about the individual's problems versus, the broader systemic structural challenges. So we know this for our clients, but we should know it for ourselves, that pathways for us to get help, sometimes that actually reinforces harm. I realize that is my screen sharing? Like when I click, does it change the slide?
No, your screen is not being shared. So I just started sharing. So I can stop sharing and you can.
You know what?
That will be live.
It's because it asked me ready to present. And I didn't hit the present now. So it should. I'm really sorry, folks.
That's okay.
How about now? Is it? Still didn't share?
It still didn't share, yeah.
Okay, what I'll do is I'll just say next slide then when I'm chatting, if you're okay to share. I'm very glad I sent you the slides before. I gotta say to folks, I was telling Urbas, who's my student, this, that I'm much more comfortable presenting in front of a room full of people there. I'm still getting my head around, online presentations. And I love that they're accessible, that we can, be in our pajamas maybe and have some coffee and still chat about social work. But I will name, I definitely find it tricky sometimes with the slides, so I do appreciate your patience.
Is it the right slide now?
Let's find out. Let me see here. Glad I printed the. Yes, it is. Perfect. Thank you. And again, I'll try and make sure to say next slide so so that we don't get out of order here. But I apologize. I didn't realize until I saw that you were the one presenting. So a post-pandemic study was done on social workers by some, it definitely involves several profs at U of T, which is wonderful. But 64% of social workers reported symptoms of burnout. And again, that term, how it's operationalized varies, right? But what they're operating from is kind of this idea that you are significantly impacted in a way that affects your day-to-day functioning. And so that's the majority of us, right? And that includes the people who, no matter how impacted they are, will never say that they're impacted. So another thing that I found really interesting is that 73% of social workers report high rates of psychosocial trauma, or ACE scores, adverse childhood experience scores. And so that's worth noting. I think it suggests that it is true that many of us get into social work at some level because we have experienced harms or injustices somewhere along the way in our lives. And I think that's okay. I think that's actually really healthy. But that drive puts many of us at higher risk for moral distress injuries, for psychological injuries, because you know firsthand the costs of system failures and social and structural inequities. And so if you get into work to mitigate those, when you can't, it understandably hits folks really deeply and in all kinds of ways. Next slide, please. So increasingly in the last few years, there's more conversation thinking about impact on us from a moral distress or moral injury lens, to try and capture that structural violence. That's the term I'll use. But when structures and systems cause harm to people at any part of the system, that's structural violence, and social workers routinely are experiencing that. The concept of moral injury comes from research with military veterans, and it's not just about seeing bad things. It's about seeing bad things, but being unable to respond to them kind of according to your own ethics, training, and sense of self. And it's also potentially being asked to do things that we don't believe are right, to folks against our own values, beliefs, or harms. It could be either one. You know, you can't do the things that you know you're supposed to, or you're being asked potentially to do things that you know aren't going to be helpful or aren't right and against your, ethical and internal kind of integrity. And the impact of that sustained kind of moral distress is an injury that leads to shame, self-doubt, withdrawal, dissonance, anger, hopelessness, depression, anxiety, fear, inflammation responses, all of the things that I think as social workers we know happen to physical bodies when they're stressed out for too long and when they don't feel safe for too long a period. Next slide, please. So social workers experience ethical strain navigating each one of these everyday problems and occurrences. Our stress around these conditions, isn't really emotional or mental health based. I would argue that it's ethical, it's relational, and it's structural. Those things certainly impact the other domains, but as social workers, I like the idea that we step back and think about, I assume most of these bubbles here, effective was named just when we were starting. These are things that in the same day, you can have all of these experiences. But there's a toll around that. And each time it happens, depending on how it resolves, again, I think there's a little bit of extra weight added. And as we're in a time in which, policies and systems are rapidly changing, I think that's becoming more acute for lots of social workers. Next slide, please. So this moral injury and moral distress, like they aren't separate concepts. I love a Venn diagram. Moral injury and moral distress, for me, I actually see them more as a continuum. I tried to make using AI, I tried to see if I could actually come up with a bit of a better shape, but it didn't go well. So we'll have to work with this one. But I sort of view moral injury and moral distress as kind of 2 points on a continuum. And underneath that is our moral integrity. So on the moral distress end, that's the alarm signal, right? I know what I'm supposed to do. I know what I need to do, but I can't do it. And or I know that this is not going to be helpful, but I'm being asked to do it. So every day this comes up, right? Watching preventable harm because of ineligibility or lack of housing resources or any number of things where we know that our inability to do something probably is going to have an impact on the person in front of us. It's a common repeated occurrence, and it's increasing as we have fewer and fewer resources and more needs. And on the other end of the spectrum then becomes that moral injury. And so if you go through that too often, you have to find a way to make sense of it. And it changes how you see yourself, how you see your work, how you see the world. And again, research is showing that you can kind of trace that impact, and you can see where folks go from this sustained moral distress into a place where they're not functioning well because of, sustained moral injury. Next slide, please. These are some quotes from a study of healthcare workers who manned an ICU unit during COVID around how they coped or, didn't cope with the overwhelming needs and lack of resources. I think my favorite quote is, and I can relate to this, is a system like this takes the altruistic care and it beats it out of you. Again, folks sometimes feel that way, but you can see here the way that folks had to cope in this sort of acute crisis and make choices. And you can imagine how, acknowledge your feelings and say, okay, but my job this time is to do the work. You can do that in a short sustained crisis and they're still told. But if you do that as your daily grind, that essentially I can't do the work in the way that I want to, but I just have to live with that. That's impactful. That's going to impact you in a way that people will say, is your mental health okay potentially? Or is your personal functioning okay? While ignoring that systemic harm that, again, just keeps getting piled onto you. Some, again, recognize it's the job. I think this happens in social work. Some recognize it just has to be that way, but others recognize it's too much. At the end of the day, though, you cannot run at that level for too long, and not being able to help hurts. We have to acknowledge that. Every time you can't help, even if you recognize there's reasons we can't help, there's still impact to that, because we didn't get into this work, I think, for the most part, because we don't care about people. There's lots of other careers, you could choose that probably are more lucrative and where you have less interaction with folks. So next slide, please. So when we initially talked about this webinar, I think we were talking about burnout, and obviously we wanted to expand that a little bit, because I think burnout says that I'm tired, from the nature of the work. Very valid. But we have to name the cost of having the individual responsibility without autonomy to act in the ways that you were trained. And most social workers hold a ton of responsibility with a lot less autonomy than that responsibility suggests. You're responsible for outcomes, but you don't control the pathways to get there. My earliest exposure to the concept of post-traumatic stress disorder was actually at a speech from General Romeo Dallaire in 2003. And he saw Canada's military contingent that was ordered to not intervene during the Rwandan genocide. And in his words, this broke General Dallaire. I remember he was, I think, arrested. He was found naked in the Ottawa River, completely drunk, shortly after he had returned. But he named really clearly that the pain wasn't just about the horrors that he saw. He knew that these things occurred in the world, but it was about he was helpless to stop it or to do the things that he felt he was trained and required to do to prevent it. And it was that helplessness in the face of suffering that really threw him. And many of us, like social workers, and we'll chat about this in a sec, we're not trained to feel helpless. We generally didn't get into this work because we think we're helpless in the face of folks' struggles. And we get into it knowing we're going to hear some really hard and heavy things. I think we assume that we can handle this personally and still do some good. But no individual social worker can hold the weight of the challenges that we see in these systems right now alone. You're becoming increasingly isolated, right? We're becoming increasingly isolated, I should say, as a profession, I think for some structural reasons. There's a push for over-professionalization and ask-based accountability measures over process. Everything is tracked now. Everything is about pulling data from systems for broader kind of government folks to look at and make sense of. But as frontline social workers, we know there are limitations to that. Lots of folks report right now that they're in our membership anyways, that they're the only social worker on a team in settings like primary care or hospitals. Multidisciplinary teams are great, but the social work role, right, is unique in its requirements to provide, care for folks as a person and to, consider social justice principles when you're engaging. You can't do that alone as a person. And you can't do it in a sustained way without support of other social workers. Post-pandemic, right, folks in general, I hear this everywhere I go, are more isolated. There's fewer third community spaces. I understand MASWO, that is not true with, and I love that. But there kind of COVID pulled back a lot of those community spaces where folks went and found some sustainment. And increasingly more folks are working from home. And I think work from home has value. I'm not weighing in on that debate, but I can tell you when I was a new social worker in child protection, I definitely survived because I had a really senior team. And some of those folks, you know, they still call me their work son. I still chat with them, but there's no way I could have made it without constantly, you know, having these more senior wise practitioners around me to ask questions and to try and help sustain me and to give me some sense of like, you know your pace here and don't overwhelm yourself. On your own, it's very hard to do that. Next slide, please. Not throwing any shade here at folks who try and promote healthy workplaces. Some folks in this space may. Self-care matters, right? I'm not anti-self-care, but a lot of the approaches that we see in workplaces can unintentionally shift those structural pressures onto individual social workers. And I get why, right? It's easier to intervene at that level. And individual supports can help, but they're not going to carry the structural failures and system violence that we see kind of day to day. All of these things, again, are wonderful. I like, you know, to have flexible work days, but no matter which 8 hours you work or how you do that, if you can't meet the needs of the folks that you're working with and, you know, the asks are overwhelming, it's still going to impact you, right? You might be able to mitigate it more, but it doesn't address kind of the root causes of the problems. And we know this as social workers, but sometimes we just forget to apply that kind of compassionate lens to ourselves when we're struggling. Next slide, please. So a pre-pandemic study was done. I think it was an American study, so I didn't include it. It followed some social workers longitudinally, but found that they had a lifetime burnout rate of 75%. So, you know, at some point in their career, 75% of social workers leave the profession for a longer period or permanently due to the weight of the work that they were doing. I don't know. I couldn't find a Canadian longitudinal number. It would be interesting to consider, but that sounds about right. You know, I think that at some point in everyone's career, there is a period of time where they might have to step back from the work, you know, take a leave, extended time off. The longer that you're in it, I think the higher the risk. So that number does show, though, that like this isn't a personal failing. Struggling to do social work long term is not about us as people. And yet, you know, how often do we hear, and I've said this as a manager to someone struggling, well, you know, go home, take care of yourself. And when I say go home, I mean like go, be well, don't worry about this place. Work's not that, you know, there's other things in life. But it also, when we say that and when we hear it, it sounds a bit like take better care of yourself, which means that the problem isn't moral distress or injury or the overwhelm of the system, but that it's just kind of in your ability to cope with that. And there's a risk when that's happening for folks that when we say just leave, you know, step out of this, that they actually become more isolated and more stuck in, I couldn't do what I was supposed to do. Now I'm not capable of being in this system at all. And so there's nuance in terms of how we, you know, manage where folks are at. And kind of, again, just assuming like leave and be well is sometimes not helpful if folks are really bumping up against kind of the sustained pressures of the ethical tensions that they're working in every day. And that makes sense, right? Isolation breeds isolation. So we have to consider our kind of own wellness, I think, with that same person and environment approach that we take with the folks that we're working with and, you know, that we learned in Social Work 101. Next slide, please. There's a bunch of quotes I could have included with this, but it isn't about our skills or our stoicism. So research is super clear that these kind of moral injury and its impacts do not care about how good a social worker you are. It does not care about your decades of frontline experience. It doesn't care about how many folks you've calmed down or, you know, seen suffer or all the horrible things that you've seen and stayed standing. I think as social workers, we do take pride in our resilience, in our ability to manage the weight of the work that we do, because we see it as care for people. You know, their problems are something that we can hold. But we forget we're not just holding their problems when we do that. We're holding entire systems that create problems at the same time. But again, you know, I was in child welfare. It was a bit of a badge of honor, especially in my early days. Your credibility to deal with crazy stuff, like the more you did it, the more you were excited about that, you know, like I can manage this, or I had this crazy situation. And there wasn't a lot of space for people to say, man, that's hard. Like, I didn't enjoy that at all. Or, yeah, I did it, but it was awful. And I went home, and cried. There wasn't a ton of space for that to happen. So our identities, I think, right, as social workers, we're helpers, we're the doers, we're carers. We can meet hard moments. But as we have established, right, we know we can't always do that. No matter what, no matter how much we want to, we just can't always do that. And so sometimes the most self-assured and confident social workers, they're going to take the hardest hit when they're unable to help or intervene in a way that their experience and training tells them that they should. So sometimes our belief in our individual resilience and our focus on that is actually a risk factor. And we know that moral distress compounds, right, when it's not acknowledged. When you're not acknowledging what happens to you, it gets worse. Next slide, please. So again, I want to name that, like, before social work exists as a profession, collective intentional care exists. And we know that our responses and desires to be professionals and solve problems for people and not with them perpetuated ongoing harm towards Indigenous folk, Black folks, racialized communities, equity-deserving communities, mentally unwell folks, you name it. When we go in to try and solve problems as the experts, we know that there's harm. So in all of this talk, while I'm going to briefly consider our past, I will be finishing soon, our future response has to recognize the importance of learning from and listening to other cultures and other ways of knowing and being when it comes to collective care. We can recognize the past and kind of disentangle ourselves, I think, intentionally from the parts of social work that cause harm to the communities we work with and by extension ourselves. So it's partly why I'm so excited to be here with MASWO. You folks are engaging in both social work practice and intentional community in a really, really powerful way. Cultures and communities since the beginning of time, right, have had approaches to keeping society healthy, to dealing with the fact that living in this world can be hard. But the Industrial Revolution comes along and it frays, many of these communities. And both incidentally, technology and migration, and intentionally, through violence and colonialism. We know this as social workers. At the end of the 19th century, all that massive technological change, the steam engine, social change creates rampant poverty, migration, exploitation, inequity. I'm not giving a first-year social work course, but I think since day one, as a profession, we've tried to meet the needs, acute needs of individuals, and also recognize the need to work with kind of communities, organizing, and challenging broader systems. Next slide, please. So, I just, nope, you're okay. I was going to skip a slide. When you skip a slide, you mess yourself up. We'll go with the history. There we go. Oh, that's really weird. Oh, no matter how much you prepare to print it out, and then when I'm not doing the slides, I knew it was going to throw me off, but I'll just wing it. So I do think there's hope right now in knowing that social work was founded as a response to deep social instability, because I think, again, we find ourselves in the middle of some pretty massive change. I don't know about anyone else, but I feel really overwhelmed about hearing about AI and trying to make sense of what's coming and where it will fit within, our work. This moment, we're definitely in a bit of a poly crisis. There's multiple things happening at once. And it's very similar to the turn of the 20th century when this profession is born as a profession. Housing issues, economic precarity, strained systems, inequality, oligarchy, fewer and fewer folks hold more and more power and money. Fewer and fewer folks control media, control banks. I've heard a joke that, Canada is, I think, 5 banks, 2 grocery store chains, and 3 telecom companies. And there's some truth to that. I mean, there's a tremendous amount of power concentrated in very few hands. And yet we stand on the front lines of the impacts on folks of these challenges. And so now I think working largely as social workers across sectors, we're doing this from an individual casework model. And it's not surprising to me that folks feel exhausted. We're coming in at the very end of a whole line of harms. And again, there's a price to be paid when we're doing that day in and day out, especially when we're not acknowledging it. Next slide, please. Okay, so beyond naming the problem, right, how do we insulate ourselves from the weight of this? And I think the panel is going to flush this out more. I got the easy part of saying, here's the problem, and we're good at doing that as social workers. But I think this sounds maybe overly simplistic, but we have to do it together, right? Like collective care matters. So MASWO obviously knows this. You're a great example of how you support social workers in community. There are formal workplace peer support models, right? Those are good. They have value. Many workplaces will have like a list of colleagues who might check in on you after critical incidents, for example. But I think even better are informal models of teamwork and shared responsibilities, routines, and informal kind of peer supports. Seeing each other as a team, as a group of social workers at all times. It matters that we stand together as social workers with each other and with the folks doing allied work. It means being kind of politically informed and active. OASW is nonpartisan, but social work is definitely political. It decides, who gets what and where and how. And we have to be aware of those conversations and part of them collectively. Social work and unions, there's a fascinating history there. I could do a whole presentation, but yes, unions have a lot of issues. I say that I was part of one, but they're also collective bodies that are designed to address working conditions. They have legal authority to do that in some ways, and they're ideally and should be democratic. So I think social workers make great union advocates and leaders. I think that our social justice approach aligns, with the labor movement, and we have to be involved in our working conditions and advocating for ourselves as well. Associations like ours, or MASWO, the Canadian Association of Social Workers, it matters to be part of social work specific spaces and have a collective voice. At OASW, for example, we collectively push for social workers to be included as psychotherapists and recognized as folks doing that work. Initially, we were not going to be included in that because we're not under the allied health professions. We stand alone as a profession under the Ministry of Child and Community Services. They always change their name. But so again, we have to advocate for ourselves to be able to do good work with the folks that we're working with. And we're not always good at naming that as social workers. At OASW, we've been thinking through communities of practice, right? Where social workers within various sectors or domains can get together and engage online. Asynchronous space to do that, synchronous conversations, engage in case reviews, peer consultations across the province from other organizations, and do some professional development together. Being involved in outside community, right, is a huge protective factor to something like moral injury, whether it's just social work specific community or any community. I know of a workplace where they gave some social workers a few hours a month to volunteer and just to be part of community in some way, to kind of reinforce their work and to recognize you can't just be in this little zone holding all of that weight. We also know that belonging to any social group, faith groups, choirs, all of these things that bring people together and sustain us as something other than individuals will help. I don't want to use the term resilient, but help keep the perspective that we need to about the weight of the work that we're doing. There are 26,000 social workers, in Ontario, so we are not alone in that. Next slide. And I think this is my last slide. I'm not sure where we're at with time. Okay, so as individuals, like we're people in an environment, and most of us are working within challenging conditions, and I think our own internal approach still matters. And I think this hopefully bleeds into where the panel is discussion will flush this out. And I'm not talking about like fake optimism or positive thinking to kind of overcome like the real challenges that folks face. But I mean, it's important to have a real grounded sense of ourselves and our purpose as social workers, kind of as part of a bigger ecosystem, as capable of doing good work, but not heroes, as caring, but not cold. An Indigenous friend once told me when I was really frazzled as I can get, I pulled my hair. She said, Dorian, you got to just find your place in the chaos. And I reflect on that often. There's definitely deep wisdom in it. And Shirley, when we were chatting about this, suggested the concept of the zone of fabulousness. And it definitely influenced to this here. I'm not an expert in it. I may come up in the panel, but thank you for that, Shirley. And just naming the importance of finding some kind of balance, right, between our integrity, our ethics, our sense of caring, and at the same time honoring our own limits to that as a person. We are part of collective work. We cannot hold it all. And some days we might be able to hold more than others, but we're mostly doing this as individual casework, right? And yet we call these folks our families, our clients. I think people do that out of a deep sense of ownership. And when we look at the chart, I imagine that we can find ourselves, in different columns or at different times. Maybe in the same day, I've been in different columns, but we shift in and out sometimes during our career. I've been overwhelmed, I've been in isolation, and we have to at least recognize that we're there and that staying there is injurious, but also that whether you're in isolation or overwhelm, none of that's a moral failing, right? Seeing this as a moral failing, as a problem with you, it just further drives shame and hopelessness and compounds the problem. These are definitely human responses. Everything on that list means you're a human being responding to kind of the burden of kind of chronic injustice day to day and trying to find a way through that. And we have to give ourselves that grace in the same way that we give others. So again, I'm not sure how I was for time there. I apologize. I confused myself with my own slides, which occasionally happens, but definitely enough of my rambling. I'm really excited to shift into the panel discussion. I will answer any questions that folks have, during the question time. I'll also pop my email in the chat. Always happy to chat with folks. But yeah, been a pleasure. And yeah, I look forward to kind of thinking through with the panel and hearing discussions around how do we sustain each other well right now? How do we operationalize some of this stuff if we know it isn't individual? Yeah, and so thank you very much for listening. And Ashish, thank you for, no matter our planning, thank you for helping me navigate the slides when I got myself confused.
Thank you, Dorian. That are some very, very powerful approaches and strategies that you discussed. As a social worker myself, I could use some of those, yes, during my work, day to day. Now, as we move to moderated panel discussions with our esteemed guests, I would like to introduce our moderator today. She is Ms. Shirley Matten, is a dedicated senior child welfare professional and registered social worker with over 20 years of experience spanning child welfare and mental health. Currently serving in a supervisory role at Brew Grace Child and Family Services. She's deeply committed to delivering quality, excellence-driven services to children and families. Shirley is also the Vice President of MASWO, who brings a strong blend of professional expertise and lived experience in forming a culturally responsive approach to practice. Grounded in the principle of compassion, accountability, she balances empathy with clear expectations to support meaningful and sustainable outcomes. Known for her collaborative leadership style, she actively mentors and supports staff, fostering growth, accountability, and best practices in service delivery. Her work is rooted in partnership, continuous learning, and a steadfast commitment to improving outcomes for children, youth, and families. Welcome, Ms. Shirley. Over to you. Thank you.
Thank you, Sonia, for that wonderful introduction. Thank you, Dorian, for that insightful and thought-provoking presentation. One thing that stands out for me is that burnout in social work is not a sign that people care less. It is often a sign that people have been caring deeply for too long in systems that don't always sustain that care. We also learned today that sustainability in social work is not an individual task. It is something we build collectively. So we are going to shift from presentation to conversation now with our panel. The question for our panel is not about how we cope, but what does it take to stay in this work, to stay well, and stay aligned with our values. We are fortunate to have a panel that brings together seasoned social workers and an emerging practitioner who bring a wealth of knowledge, compassion, and real-world insight. They have not only worked through the challenges we are discussing here today, they have reflected on them, they have learned from them, and continue to shape how this work can be done sustainably. It is my privilege to introduce to you our panelists. Our first panelist is Irbaz Saeed. Irbaz is a Master of Social Work student at the University of Waterloo, currently completing his placement with the Ontario Association of Social Workers. Before entering macro-level practice, Irbaz worked in frontline mental health roles across many organizations. Our next panelist is Irbaz's work has focused on supporting individuals experiencing complex mental health challenges, often within systems impacted by inequity and limited resources. His lived and professional experiences have shaped a growing interest in addressing burnout and moral injury among social workers, particularly as they relate to systemic barriers and gaps in care. Our next panelist is Anu Matthew, a social worker from correctional setting. Anu is a registered social worker with over 14 years of experience supporting children, youth, and families across diverse settings. She currently works with the Ministry of Children, Community, and Social Services at the Roy McMurdy Youth Center, where she provides comprehensive, culturally responsive care to youth in conflict with the law. Anu brings deep expertise in mental health, crisis intervention, and reintegration planning alongside a strong commitment to advocacy and community collaboration. Her work is grounded in compassion, guided by evidence-based practices, and focused on empowering young people to create meaningful and lasting change in their lives. Our next panelist is Abby Thomas, social worker from Long-Term Care Center. Abby is a registered social worker with over 12 years of experience working in high-stress environments across community settings, mental health, corrections, and primary care. Currently, Abby works as a long-term care home inspector with the Ministry of Long-Term Care. In this role, Abby uses a clinician's lens to issues of quality, safety, and accountability. Abby's practice is grounded in anti-oppressive values and care for the workforce. Our next panelist is Cece Daniel, registered social worker and a psychotherapist with over 25 years of experience spanning the nonprofit, education, and private sectors. Her career includes over 2 decades in community-based family agencies, both as a frontline clinician and as a clinical supervisor. Since 2018, Cece has served as a dual language social worker with the Dufferin Peel Catholic District School Board, bridging the intersections of mental health, immigration, and settlement for students and families. Currently, she is also in private practice, specializing in trauma-informed relational care. Cece offers a macro to micro view of the structural pressures of her profession. She's here to share her journey of staying grounded while working within our most challenging systems. Our last panelist is Joji M. John, registered social worker from the child welfare sector. Joji is a seasoned social worker with over 17 years of experience across diverse practice settings, both in India and Canada. His work experiences includes child protection, mental health, and community practice. He currently serves as a child welfare supervisor at the Children's Aid Society of Toronto, where he is committed to strengthening outcomes for children, youth, and families through equity-focused and trauma-informed practice. Joji is also the founding president of MASWO, a thriving professional network of over 700 members. He is passionate about creating culturally responsive systems and fostering meaningful partnerships between communities and institutions. He brings a collaborative leadership style and a deep commitment to empowering communities and advancing the social work profession. A warm welcome to all of our panelists, and thank you for joining us today, for bringing your experience and perspective into this conversation. Before we begin, I'd like to share a quick note about the purpose of today's panel. The discussion is meant for information sharing and reflective learning only. Some of the experiences shared may touch on challenging aspects of practice. So please take care of yourself as needed throughout. You may have questions in the end. We encourage you to reflect and on what resonates with you. Continue these conversations with your peers and colleagues, or bring these conversations into your workspace and advocate for meaningful change. On that note, I would love to start by getting to know our panelists a bit more. Here's the first question to each of our panelists. Briefly share what first drew you to social work and what continues to sustain your commitment to this profession today. And let's start with Joji.
Okay, good morning, everyone. First of all, thank you, Dorian, for the excellent presentation. I loved you bringing child welfare perspective, especially me coming from child welfare. I also sincerely appreciate MASWO for organizing this meaningful conversation. And thank you, Shirley, for the thoughtful question. I often say that I didn't choose social work. Social work found me through lived experiences and meaningful connections. I began my academic journey in commerce, planning to pursue an MBA, following the usual expectation of a stable and successful career. But everything changed during my undergraduate years when I started visiting a small hospital near my home that provided palliative care for cancer patients and support for children with disabilities. There, I wasn't just observing, I was listening to people's stories, sitting with the families in difficult moments, and witnessing both pain and resilience. I also met social work students during their placements, and those interactions opened my eyes to a profession rooted in empathy, dignity, and human connection. That experience stayed with me and ultimately led me to pursue a Master of Social Work. My journey since then has not been easy. I moved across India for my first role, working with underserved communities, and later immigrated to Canada, where I had to rebuild my career from the ground up. Like many newcomers, I faced barriers to survival jobs and completed bridging program before entering the field again. Today, I work in child protection, a space that is complex, often misunderstood, and deeply challenging. But what sustains me is a strong sense of purpose. I believe our role is not just to protect children, but to support families, to walk alongside them, build trust, and help create conditions where children can be safe within their own families whenever possible. This work can be emotionally demanding. So I am intentional about self care, like setting boundaries, staying connected to my support system, and making time for things that help me recharge. At the end of the day, what keeps me going is simple: the belief that even in the most difficult situations, we have the ability to bring hope, restore dignity, and make a lasting difference in someone's life. Thank you.
Um, Thanks for sharing, Joji. Um, I guess I'll go next. So I'm Urbaz. I'm a placement student at OASW. And if I'm being honest, as a kid, I didn't really think I'd be a social worker when I grew up. I wanted to be something like an astronaut, or even I remember wanting to work at McDonald's because I liked the food as a kid. But I kind of ended up here by chance. I was doing my bachelor's in forensic science at Laurentian, and after my first year, pandemic hit, and it ended up going into social work. And I think growing up, I didn't really know what social work was until I got into the program and I was looking into it. I was involved in a lot of community work, and I had around 700 hours by the end of high school. I never connected that to a career. But what I can say is that what kept me here is what social work has done for me now. It changed how I think, how I see the world. It's helped me to start to decolonize my own thinking, how I understand people, systems, and even myself. I think what really made it stick for me was the people, the mentors and supervisors I've had who are social workers, the way they approach people with care, but also with intention and critical thinking. That really shaped me. And there's this idea that ignorance is bliss. And honestly, I get it, but sometimes not knowing feels easier. But there's also something really freeing about being able to see things clearly, to understand systems, and to care deeply without looking away. For me, that's what sustains me, not just the work itself, but the way it's changed how I exist in the world and how I show up for others.
I guess I will go next. Thanks, Urbas. My 11-year-old son wants to be an astronaut now. Maybe he will turn to be a social worker. So I was drawn to social work because I always had a strong desire to help people who are going through difficult times. I wanted to be someone who could really listen, understand, and support others when they feel stuck or alone. So it felt like a meaningful career, being able to stand alongside someone and remind them that they are not facing this alone. And what keeps me still is the same reason. Every day I get to see strength and resilience in people, even when they don't see in themselves. That's something that never stops inspiring me. No matter how challenging the situation is, there is always some level of hope or change, and being part of that process is incredibly rewarding. I think what stays with me the most are the small, quiet moments when someone starts to open up, when they take one positive step, or when you see shift in their thinking. That is so powerful. Social work is not an easy job, as we all know. There are tough days. It can be emotionally demanding too, but the impact, even when it feels small, is real. Ultimately, it's all about connection and being present for others. That's what drew me in, and that's what continues to keep me as a social worker. Thank you.
I think I will go next. Good morning, all. My name is Abby Thomas, and I would say what first drew me to social work probably began in my early life, because I grew up watching my father, who was a politician involved in local community issues. I believe that early exposure probably shaped my pursuing this career later in my life. But I would say the moment it truly crystallized for me was during my undergraduate studies. I believe one of my first days in my program, one of the professors asked me, he was asking every student, so he asked me, what you want to become? I said, I want to become a social worker. Then he asked me, where do you want to study, or what kind of social work do you want to worker you want to become? Then I didn't have any clue. So what I did was I started studying about social work and various options it provides. So by the time I completed my undergraduate degree, I knew this was the path I wanted to pursue, where I wanted to study, so forth. What sustains my commitment today is the profession's core values, working alongside people who are disadvantaged or marginalized, and working through the challenging systems that create inequity, and doing work that is grounded in dignity, justice, and compassion, even during the challenging moments. That purposes continue and anchor and motivate me. Thank you.
Wow. Good morning, everybody. My name is Sassy. Just hearing my fellow panelists, it just warms my heart, because I can clearly hear and see that there is a common thread that binds us all as we choose this profession, or the profession chose us. No matter, I think I'm hearing a common theme here. So I'm so grateful, Shirley, for this opening question, as it's given me opportunity to reflect and give credit where it's due. If I had the option, all of the above, I think I'm going to repeat some of the things that you've already heard from my fellow panelists. So firstly, I think I'm inspired and also indebted to my parents, as they gave my two older siblings and I an upbringing and a home environment in India, where they taught us a language called service. I watched my mother balance her nursing shifts and manage the home front. I saw my father, a physiotherapist who held a full-time job at a hospital, at a community hospital, but also pioneered the hustle long before we had that word back in the 1960s and 70s, and had a very small private practice after his full-time job, and that he ran more out of charity than for money. From them, I learned what true care and compassion is, and that is just not abstract values, that they are daily actions. From them, I learned showing up for people in their hardest moments is a fundamental, not just professional responsibility, but our human responsibility and obligation and duty. And from them, I learned that social work or any work in this profession is not tasks, but it's an act and actions of our heart. So I think I owe it to my parents that, they laid these solid, fundamental values. And now I understand better why I was led into this profession. And then secondly, I think my formal education, I owe it to that. I have a double master's in social work 30 years ago from India, and then 20 years ago from Toronto. So I truly now understand not just the why, but how to be an effective social worker, how to be a grounded and helpful social worker. And I think that's the education that taught me that. It helped me gain the tools. I learned how to navigate complex systems. It taught me the importance of trauma-informed care. It gave me clinical frameworks that allow me to support people effectively without losing myself in the process. And I think it actually taught me how to turn empathy into impact. And lastly, I think what truly sustains my commitment today in this field for 30 years, what keeps me showing up for work every day are the voices of my clients, the stories of my clients, and the colleagues that I get to work along with for them. I carry my clients' stories with me. When a client, I think Anu already mentioned this, and most of us mentioned this, that when a client finally finds their footing or discovers their own strength that they didn't know they had, I think it reinforces my belief. It brings back that fire in me, that human connections and the resilience that proceeds out of it is because of our profession. So I'm here because of the values my family instilled in me. I'm here because of what I studied. I'm here because of the incredible clients and my colleagues in the field who trust me with their journeys every day. And that's what makes this profession not just a job for me, but I think it's a lifelong calling.
Thank you all. Just like Cece, I'm also already hearing some strong threads of purpose, value, and connection that drew each one of you to social work profession. So I'd like to build on that foundation and dig a little bit deeper. We all know that burnout isn't a sign of weakness, and it's often a response of doing deeply demanding work and doesn't happen overnight. Anu, can you talk to us about some early signs of burnout you may have experienced, and how did you recognize, how did you recover? If you're comfortable, can you talk to us about what helped you move from awareness to actually making changes?
Sure, Shirley. So as an answer to this question, I want to share something a little personal, because burnout for me was not just a concept, it was an experience that changed me. 2-3 years ago in my career, I was a person who said yes to everything. I cared so deeply about the youth and families I worked with. I believed that showing up fully meant giving more of my time, more of my energy, more of myself. And for a while, it felt meaningful, it felt right, but slowly something began to shift. I remember waking up already feeling tired, not just physically, but emotionally. The work that once energized me started to feel heavy. I was still showing up for work, but inside I was running on empty. My empathy felt harder to access, and even when I left work, I never really left. I carried every story I heard, every worry, every responsibility with me, and that affected the responsibilities I have at home with my family, my children. At first, I told myself, this is just part of the job, so push through. But pushing through came at a cost. What I did not recognize right away was that my burnout had deepened into something more. It began to affect my overall well being in a very significant way. I reached a point in my life where I knew I needed support, but honestly, that was not an easy step. Even though I'm a social worker and I'm aware of so many mental health resources, when it came to me, I struggled to know where to go. One side of my family, who are deeply rooted in faith, encouraged me to pray harder. And I respect that because I believe in prayer too. But on the other side, I knew that I was going through something that needed professional support as well. Trying to explain that to my family itself was very difficult because there is a lot of stigma attached to it and lack of awareness around mental health in the culture I come from. So instead of reaching out to trained professionals, I reached out to friends, mentors, faith leaders, pastors, whatnot. Reached out to every person I can go to, whom I trust, actually, of course, but I felt stuck. I remember even my sisters who love me so much told me just to pray harder. It came from a place of care, but I had to explain why I needed more, why professional help mattered. In that state of depression, I had to teach my sisters why I needed to go. Then came one of the hardest decision of my life, to step away from work completely, because it was hard for me because work had always been a big part of who I was. It's where I felt purposeful, where I felt like I was making a difference. So stepping away forced me to ask myself a hard question. Who am I if I am not constantly giving to others? Life became meaningless, and eventually I did not want to live. My family became so worried seeing my condition. So in short, recovery for me from that deep pit I was in, that time was not quick or easy. It was very slow, sometimes uncomfortable, sometimes I was frustrated that I am not able to go back to my normal self. There were days I questioned everything, but then I started to do the work. I prayed, I trusted God, I trusted the process, I reached out for professional help, I gave myself time, which most of us don't give. We need everything instantly, but time helped me a lot. Giving time to heal myself, to recover myself. I had to learn how to rest without feeling guilty. I had to learn that boundaries are not barriers, but they are protection. And I had to reconnect with who I am outside of my role as the helper. So little by little, I began to rebuild not just my ability to work, but my ability to actually live and be present. And today, I'm still a social worker, but I show up differently. I still care deeply, but I'm still committed to work. But I no longer believe that giving everything of myself is what makes me good at what I do. I've learned that burnout is not a sign of weakness. It's often a sign that we've been strong for too long without enough support, without enough pause. And stepping back is not a failure. It is the most courageous and necessary step toward healing. So if there is one thing I would leave with you all is this: take care of yourself with the same compassion you give to others, because the work we do matters. So do you and I. Thank you.
Thank you so much, Anu, for sharing so openly. It really highlights that burnout often shows up gradually, doesn't happen overnight, and how easy it is to normalize those early signs until they become overwhelming. I want to bring another layer to this conversation. Irbaz, I wonder if you could briefly talk to us about how culture, community, or professional identity shape how burnout or moral distress is experienced or navigated.
Yeah, I believe as a male social worker, more specifically a South Asian Muslim man, I've experienced social work a bit differently. One thing I really felt is that the way I experience and express emotions doesn't always align with what's expected in our professional spaces. There's often this unspoken idea of what distress should look like, how it should sound, how it should be communicated. And when you don't fit that, it can get missed. I've had moments where I was struggling, but because I wasn't expressing it in a way that was easily recognizable, it was either misunderstood or I just felt invisible. And that does something to you over time. It did something to me because it's not just that you're dealing with the work, you're also managing or even micromanaging how you show up in a way that will be understood. You start adjusting yourself, translating your emotions, or even holding things in because it feels easier than being misread. And I think for a lot of racialized folks or people from different cultural backgrounds, that's not uncommon. Our emotions look different, our ways of processing looks different, but that doesn't make them any less real or any less serious. So for me, burnout and moral distress isn't just about workload, they're about whether you're actually seen in your workplace. Because if your experience isn't recognized, then support doesn't come. And that's where the work starts to feel really isolating. And when you're doing the work that already asks so much of you and feeling alone in it, that's what really accelerates burnout.
That is such an important perspective. Thanks, Irbaz, for that. So I'd like to now shift gears and talk about something that's gaining traction, compassionate accountability. So what does compassionate accountability mean in your social work practice? I wonder if Abby can share with us from your experience.
I would say for especially someone like me as a racialized social worker from South Asia or India, we feel compassion, accountability. If we don't have compassion, we are going to held accountable for that. So especially when I came from a different practice settings where we didn't care much about these things. When we started working in Canada, I didn't have much idea about the social work practices as I was learning. I felt like it's my responsibility to take care of my clients, and even I wasn't even sure that what they wanted to do with their lives. Even I thought, yeah, okay, this is the perceived standard. They have to take their medications, they have to maintain their housing, and I took it personally. But it took a toll on my mental health at the beginning. I had nightmares, like, would wake up in the middle of night thinking about my clients. As Anu mentioned, I never left my client at work. Like, it has been bothering me throughout my day. And so I feel like it took a while for me to understand with the help of a good mentor. Luckily, I had one at my work. I would say for compassionate accountability, it's about holding people and systems that we work with responsible in a way that still honors people's dignity, the context we work, and humanity. I think we often struggle with that because we know that we often work with people who are marginalized and peripherals of the society. So personally, I feel like holding them accountable for their actions kind of not doing justice to them. And so I often take, like, I was at the receiving end, or I personally took extra miles and oftentimes ignore such actions from my clients. So, but it took some time. I believe I after a while, I learned, okay, I can survive as a social worker like this. So I need to be making them accountable or helping them to take charge of their lives. I think that's my take. Like, and at the same time, working with the system as well as the employer, who often pressured us to take more workloads, and saying no to them was even a challenge, because I had to have a job, and initially I feared that if I say that, am I going to get fired? So it took years of practice for me to become like an accountable, how I'm going to be accountable to myself, and at the same time keeping the clients I am working accountable, the system I am working accountable, my employer, I'm providing me employment accountable.
Thanks, Abhi. Let's bring in another perspective in. Cece, I wonder if you have any thoughts on that.
Just going to add a few more points from my perspective as a frontline worker, as a clinician in private practice, but also having been in the nonprofit sector for over 17 years. I just want to share from those lenses, and also wearing a dual hat within the nonprofit as well as the private sector, when I'm holding both clinical supervisor or manager role as well as frontline staff role, So for me, compassion, accountability is the courage to speak the truth with kindness across every level of our work, whether it's with our client, a team member, or a manager, or a CEO, or a clinic owner, I think it requires the humility to make space for repair if that truth is felt as harsh, and the bravery to hold up a mirror to the barriers we often want to ignore. For me, compassionate accountability is not punishment, it is a form of care. And how it looks in my practice is when, with a client, I use compassionate inquiry to hold them accountable to their own growth. Instead of judging a behavior, I hold up the mirror and I might say, hey, I see you much angry right now for the situation that you're dealing with. But can I invite you to reflect how this anger is benefiting you or the system or the people around you? Is there any other feeling that's sitting alongside anger that we can tap into and see if we can express it in some ways that can help you and the others around you? So that, to me, with a client, is how I hold them towards growth. It isn't about them being wrong. It's about helping them to recognize the internal as well as external barriers so that they can tap into their own capacity to transform. In my supervisory role, and even in my own self-practice, I'm going to be vulnerable here. And I think all my fellow panelists, thank you for taking the courage to be so honest and so vulnerable here, in my own self-practice and as well as in my supervisory role, I know for us as social workers, an area where we all struggle is documentation. So compassionate accountability here means acknowledging that truth. That is often the least rewarding part of our job and the hardest balance to strike. So instead of just demanding the deadline with my team members, I again hold the same mirror to the struggle. I ask, hey, what can help us, and why is this happening? And can we co-create a functional plan, whether that's allotting, specific documentation days or using peer review? It's about being accountable to the standard, but bringing compassion to the human energy it takes to meet the standard. And finally, in my role as an employee with the management or with a clinic owner, compassionate accountability has taken the form of being a witness or advocate for those who have no voice in the boardroom. It is the courage to tell management or a clinic owner that it is burden to expect my client to come into the office when they're being monitored by an in-law or isolated or depleted of funds. It means pushing back on fees increases that alienate my hurting client and just can't afford therapy anymore. It's sometimes the ultimate act of compassionate accountability is the decision to take a break, as Anu mentioned. And for me personally, I've left jobs. I've resigned at my jobs. I've resigned within systems. Why? For me, it was no longer matching with my values. Leaving was and is an act of accountability for me, to my clients, to my profession as a social worker, and to my own self worth. I firmly believe that it's really difficult to provide compassion, care, if we are practicing in a state of moral compromise. So I think it's a valuable question that you've asked, Shirley, and a difficult answer, I think, but I hope it resonates with some of you.
For sure. Thank you so much. I really appreciate that framing. I appreciate both of your perspective on that. So it just challenges the idea that we have to choose between being compassionate and being accountable, when in reality, sustainable practice often requires both. And, based on what you're sharing, you have found ways and different situations to face that very situation. The compassion accountability piece at all levels. So thank you for that. So to all the audience, for the interest of time, we are going to skip quite a few questions, unfortunately. So I hope you can be patient with us. Looks like we will just go overboard by a few minutes than planned. I wonder, Joji, can I just get back to you? Can you talk to us just about how organizations move from expecting individuals to cope alone to building systems of shared care? Can you also touch a little bit about the power of team culture and team dynamics within that context of collective care?
Thank you, Shirley. I will briefly answer that question. One of the biggest shifts organizations need to make moving from an individual responsibility model, you take care of yourself, to a collective responsibility model, we take care of each other. From my experience as a supervisor in child protection at the Children's Aid Society, the work is inherently high pressure, court timelines, crisis responses, heavy documentation, and emotional exposure to trauma. In that kind of environment, self care alone is not enough. No amount of mindfulness or vacation can compensate for a system that is overwhelmed. So, building shared care starts with the leadership. Supervisors need to actively create psychologically safe spaces where staff can debrief openly without fear of judgment. In my team, regular check-ins are not just about case updates. They are about how the worker is doing as a person. Second, organizations need to normalize team-based care. That means shared caseload thinking, peer support, and collective problem solving rather than isolating worker with the complex cases. When one worker is struggling, the question should not be, why can't they cope? But how can the team hold this together? Third, policies must reflect care, not just productivity. Reasonable caseloads, reflective supervision, access to clinical consultation, and protected time for learning and decompression are critical. Otherwise, we are unintentionally rewarding burnout. Finally, we need to shift the culture. In social work, there is often an unspoken expectation to be resilient at all costs, but real resilience is relational. It comes from connection, support, and feeling valued. So, moving to a shared care means embedding care into supervision, team culture, and organizational policies, not leaving it to individuals to survive on their own.
Thank you, Joji. So I'm hearing a strong theme here. Sustainability isn't just an individual responsibility, it is collective. And thank you for that. I'd like to move us along to a place of hope and possibility. Again, due to time, I'm going to pose one last question to all of our panelists. So, what keeps you motivated, and give us a piece of wisdom that you would give, sorry, to social workers who want to sustain themselves in this work for the long term? Let me repeat that question. So, what keeps you motivated, and what advice or piece of wisdom you would give to social workers who want to sustain themselves in this work for the long term? Sissy, can we start with you?
Hmm. I think it's very similar to the first question that you asked us. So I think I'm just going to make it very brief. Family, family of origin, family that we go back home to, that sustains me and that motivates me. Um, Pieces of wisdom that I can offer to my colleagues here for the long term is this: uh, do not internalize the system's vision of you. Please seek your own truth. Sustain yourself by anchoring your identity in your values, not in outputs that the system requires of us all the time. Celebrate the slow work, the pauses, the much needed pauses. Let's continue to build a community of radical honesty where we can name our moral injuries and heal them together. As Dorian mentioned in his slides, that what we don't name, we can't heal. And please remember that the system may not see always the depths of our impact, but the human being that you're sitting across, whether it's your colleague or whether it's your client, our precious clients, they are the testament to our passion, our hard work, and our healing presence. Thanks, Shirley.
Who wants to go next on the panel?
I can go next then. One piece of advice I'd give is you're not meant to do this work alone. It's important to find people who understand you, who see you, who don't require you to explain yourself all the time. That's what makes this work sustainable. One idea that's circulating online is, and that honestly I really support, is that you have to be a villager to build a village. We can't just wait for leadership or systems to create better environments. A lot of what makes a workplace feel supportive not comes down to how we show up for each other day to day. It's in noticing when someone is quiet, not assuming they're fine. It's in making space for different ways of expressing stress. It's in choosing to understand instead of quickly labeling someone's behavior. So yes, structural change matters, workload, resources, all of that. But culture is built in those small interactions.
I'll go next. I would say one thing I want to tell: if you think that the system, the current work is not working for you, it's having an impact on your emotional overall well-being, I would say, leave that and find something that's going to going to enjoy. And I realize that I can fix. No, I'm not that. I cannot fix everything, and have that understanding, and let people. I believe people have an inherent ability and capacity to take care of their lives, and start working on that assumption. Clients or people we work, they have their own ability and capacity. Work within that capacity. Oftentimes, we set parameters or standards, but it creates a struggle, and clients won't probably never achieve that. And this is a marathon, not a sprint. So, if you are sprinting, we are going to exercise soon. So, take your time, I believe. Thank you.
Okay, I can go next. So, what keeps me motivated in this work is really the impact. Sometimes visible, sometimes not. In child protection, we don't always see immediate success stories, But we know that even small interventions can change the trajectory of a child or family's life. That sense of purpose keeps me grounded. And as a supervisor, what also motivates me is supporting my team, seeing workers grow in confidence, navigate complex situations, and continue to show up with compassion despite the challenges. That collective resilience is very powerful. At the same time, I have learned that motivation is not something that just comes naturally every day. There are difficult days, and in this field, that is inevitable. So, sustaining ourselves requiring being intentional. If I were to one piece of wisdom, it would be this: don't try to carry the work alone. Social work is relational, not just with clients, but with colleagues as well. Lean into your team, use supervision meaningfully, and create spaces where you can reflect, question, and even feel vulnerable. Also, be clear about your boundaries. Caring deeply does not mean overextending yourself to the point of burnout. The work will always be there, but you have to sustain yourself to continue doing well. And finally, stay connected to your why, whether it is social justice, supporting families, or advocating for children. Keep revisiting that purpose. It evolves over time, but it is what anchors you through the challenges, because in the long run, it is not just passion that sustains us, it is connection, reflection, and balance. Thank you.
Okay, so I'll go next. What keeps me what keeps me motivated is the people, the small moments of growth, honesty, and resilience I get to witness every day. Even when the progress feels slow, because most of the time I don't see the change in the youth I work with, because once they are released from custody, we have no connection with them. So it's the hope that what I planted in their heart will grow in some way. So those moments remind me that sometimes I hear back from them, and that's where I remind myself that the work I truly do matters. And one piece of advice I would share is don't lose yourself in the work, which I did once upon a time. Set boundaries, take care of your well being, your family comes first, then work. At workplace, we are just one of the team member, but our family needs us. They have only us to be part of them and to take care of them. And the social work is a marathon, not sprint. So go slow by taking care of yourself along the way.
Thank you. Thank you to each of our panelists for your honesty, wisdom, and vulnerability today. We learned about the power of connection, mentorship, and shared responsibility in creating sustainable social practice. So thank you again for sharing your experience and perspectives today. As we leave, I invite each one of us to reflect on one question. What is one small shift you can make within your role or sphere of influence that supports not just your own sustainability, but those around you? I'd like to take this moment to extend our sincere gratitude on behalf of MASWO to our friends at OASW, especially Dorian and Erbas for collaborating with MASWO in organizing today's event. Thanks to MASWO's executive committee members, Ashish and Varghese, for your tireless efforts in making this event possible today. Thank you to our MC, Sonia Menon, for guiding us through this program with such ease and professionalism. Thanks to Lindsay for delivering a meaningful land acknowledgement. Thanks again to each of you for your participation today. You'll be receiving a feedback survey form along with a list of curated resources by email from MASWO in the next few days. Again, we are sorry, in the interest of time, we had to skip a few questions and we have missed out on our experience hearing from our panelists. But if you have questions, feel free to reach us through our email, and we'll try our best to answer those for you. So this concludes today's event. Have a wonderful day, everyone, and take good care.